Get your grin off your face.
Have you ever been around someone who coughs and wheezes on a regular basis? Many of us have probably been around someone who has struggled with breathing at some point in time that have been diagnosed with asthma. There are many different triggers that can cause an asthma attack. There is no known cause for asthma, but for someone who suffers from it, knowing their individual triggers is the key to preventing an asthma attack. The treatment of asthma is different for each person that suffers from asthma. So what exactly is asthma? According to the American Academy of Allergy, Asthma, and Immunology, 1 in 12 people in the United States suffer from asthma, and the number continues to rise. Asthma is a disease that affects the airways and lungs. People who suffer from asthma always have, their airways are always inflamed. Once the airways become swollen, the muscles around them begin to tighten, and this is what causes the asthma attack. Okay, this is going to be a short video produced by the Mayo Clinic on what happens when someone has an asthma attack.
When you're not having asthma symptoms, your airways are clear. Air can easily flow in and out of your lungs. When an asthma attack begins, the smooth muscles around the outside of the tubes may tighten. The airways, or bronchial tubes in the lungs, become inflamed and swollen. This makes it difficult for air to pass through the opening. The mucous membrane lining in the tubes begins to produce thick mucus, which builds up and further blocks the airways. This tightened airway may result in a wheezing sound and shortness of breath, signs and symptoms of an asthma attack.
Many people who suffer from asthma do not show any symptoms at all until the attack occurs. Symptoms of an asthma attack include shortness of breath, tightness in the chest, coughing, and wheezing. How many of you think that only people suffer from asthma that smoke or are around other people that smoke? Although people who suffer from asthma usually have the same symptoms, the triggers that can cause the attacks vary in each person. Some examples of triggers are airborne substances such as dust, pollen, pet dander, common colds, stress, physical activity, smoke, cleaners, and a change in the weather. Can asthma attacks be prevented? Doctors have not determined a prevention for asthma, but have found some factors that are thought to increase the chances of someone developing it. Once asthma has developed, there are steps that you can help to prevent it. Some factors shown to increase the chances of developing asthma are having a blood relative with it, being overweight, smoking, or being exposed to secondhand smoke. You can also have allergies, and exposure to different pollutants or chemicals are also things that can cause asthma. For those who already have asthma, their focus is on trying to prevent an asthma attack. And the most effective way to do this is to know your triggers and to avoid them. It's also important to follow your doctor's instructions for managing your asthma. You may be wondering what types of treatments are available for those who suffer from asthma. Once someone is diagnosed with it, their doctor will help them develop a plan for monitoring their disease. Specific triggers will be identified to help them, each individual recognize and avoid them. Oral medications and inhalers can be prescribed on a daily basis to be used as a preventative. If someone suffers from an asthma attack, they may have to use a rescue inhaler to quickly relax and open their airways. And they may have to take steroids orally or intravenously for a more serious attack. Understanding asthma, its triggers, and its prevention and treatment are essential and could possibly save someone's life. Asthma is a disease that already affects 1 in 12 people, and the number is rising. As you have heard today, there are many different things that can trigger an asthma attack. Becoming educated on the triggers and possible risk factors for developing asthma can help you prevent an asthma attack or save someone's life. If you have already been diagnosed with asthma, communication with your doctor is the key to preventing and maintaining serious asthma attacks.